Welcome to Recalculating Small Business. Like its award-winning book, Recalculating is dedicated to small business in America. Your hosts are Don Mazzella and Dan Perkins. Don Mazzella is the editor-in-chief of the Small Business Digest. Dan Perkins is a registered investment advisor with 43 years' experience in managing money.
Dan Perkins here, your co-host, along with Don Mazzella of Recalculating for Small Business. Our radio program is dedicated to you, helping the small business owners increase their profits. We draw our name from Recalculating, voted the best small business book of 2017 by the Independent Press. In this book, it features ways to grow your small business. Now, here's Don Mazzella.
Welcome to Recalculating Radio. I'm your host, Don Mazzella. My co-host, Dan Perkins, is on assignment. But we are really pleased today to have a guest who talks about a subject that's very dear to my heart, as caregiving. Dr. Eric DeJonge is Executive Director of an organization that we all should know about. Dr. DeJonge, welcome to the program.
Thank you very much, Don.
Now, tell us a little bit about your background, a little bit, and then your organization, and where people can find out more information.
Sure, thank you. So I'm Dr. Eric DeJonge. I'm a geriatrics doctor. I take care of older patients. I do primary care here in Washington, D.C., doing house calls. I'm the president of the American Academy of Home Care Medicine, and the website for that is aahcm.org for more information. My background is for 20 years. I've been actually a geriatrician here in the D.C., Baltimore area, serving kind of elders generally over the age of 80 up until my oldest patient was 113. And we do home-based primary care, essentially house calls for the most sick and frail elders in our community. I've been doing this in D.C. for about 20 years. We also have recently started a program in Baltimore. So that's my background, Don.
Wow, that's exciting because, a home care doctor is almost non-existent in this world today. My first question is, how did you get involved with it, and why did you decide not to stay in the office but get out there and actually be with your patients?
That's a great question. So when I was in 1992, about 25 years ago, I was a resident in Baltimore, and my kind of teacher, Dr. John Burton in geriatrics at Johns Hopkins, gave me 10 patients. He said, these are your patients, but they can't get into the office because they're disabled. And he said, you have to go take care of them at home. And that's how I got into this. I kind of learned what it was like for a patient and a family to struggle at home alone and have trouble getting to the doctor's office until they end up, having to call 911. And so I learned about doing primary care in the home and how much better it is for the patient and the family, and how much more I can learn, and so I can take better care of them at home. And often, basically, since I finished my training over 20 years ago, I've been doing this kind of work and find it very rewarding, but also, more importantly, think it's better for the patient and the family. And the other great aspect of it is that it keeps the costs of care down because it keeps patients out of the hospital, which is the most expensive place in the world to be.
Yeah, well, that may be true, Doctor, but how do you make a living? I was told that home care, you get paid the same amount from Medicare, et cetera, for a office visit as for a home visit. I was told, and that's the reason why older people had to come into the office. But my first question, how can the people in Washington be so lucky?
Right, great question. So making a living doing this kind of work is a challenge, to be honest. There's different types of practices that are trying different business models, Don, that can work to varying degrees. So one way that some of my colleagues around the country are doing this that is financially sustainable is to do house calls in large senior communities, so senior apartment buildings, assisted livings, these campuses where there might be 100 or 200 seniors living in one place, so you don't have to spend as much time in the car driving all over. That's one option that helps. A second option is to get paid not for just each visit that you make, because it's hard to make a lot of visits in a day, but to get paid for the results, the value of what you provide to the patients in the population. And Medicare and actually Medicare Advantage plans, businesses around the country are recognizing that home-based primary care allows you to reduce the total cost of care, and they're now paying practices extra who are willing to go out and do this kind of work. So there are some paths to making a living, or breaking even at least, by doing this kind of work.
Well, you'd be commended for it. I know in the case of my own father, when I was taking care of him, the doctor, our local doctor, came and saw him at home, and it meant so much. But I subsequently discovered that he lost money every time he came, but he still came. And we don't see that anymore. The doctors are caring, but simply because of the reimbursement schedule, they simply can't afford to. Is this going to be a trend, because as the population ages, there's going to be more and more of this?
I certainly hope so. There's a huge need. There's about 2 million Medicare patients right now who need this kind of care, patients who are disabled, have struggled to get out of the house, for either dementia, because of dementia, or physical disability. And only about 100,000 of those patients are actually getting this kind of home-based primary care. So there's a huge unmet need, and we have to kind of develop the financial support for it, as you were touching on, as well as the workforce to build teams to serve those folks. But there's a huge need for it, and so I hope the demand will generate, more of this kind of care.
Well, you're on this program because we think it's so important. I also know from experience that smaller companies seem to be much more flexible in working out ways of helping elderly people, parents of employees, etc. Is that something you've seen in your practice?
Well, yeah, so there's different kind of companies that do different services, Don. So, for example, if I have a patient who needs a private home health aide to help keep him safe at home and keep him out of the nursing home, small companies, small businesses often provide those kind of daily support services like home health aides. And the good ones, train their aides well, they have good caring people, and they charge a reasonable amount, and patients and families will hire them. Slightly larger companies are like the Medicare Advantage companies or some healthcare insurance companies. Some are medium-sized, some are larger, are starting to do more home-based care services because their goal is to keep people out of the hospital. So there are companies who provide medical equipment, pharmacies who provide delivery of medications to the home. We work with several small businesses in D.C. who do a really nice job of same-day delivery of medications to get those medicines out to the patient and family when they need them. So there's probably about 15 different types of services that my patients and families use. Many of them are supplied by small or medium-sized businesses.
Well, in your own case, what does your association do, and what is its mission and goals?
Sure. So the American Academy of Home Care Medicine is really trying to promote the practice of house calls around the United States, to try to have it be a high quality of care, and to try to promote better payment for this kind of service, because if you don't have a margin, then it's hard to have the mission continue. So our academy has about 1,000 members around the country who are some type of home care medicine workforce, doctors, nurse practitioners, social workers, business staff in the field. And our goal is to really grow the field so we can serve, all of those 2 million patients who I mentioned in Medicare who are really in need of this.
Well, we're all aware of this tidal wave of older patients that are living longer, and it seems to me that's a huge overhang that the nation faces over the next 20 years. What do you say to that?
I say you're right. I would say the people who we particularly need to focus on are folks really in the 80 and over age group. There's a lot of younger baby boomers turning 65, but they tend to be pretty independent, pretty healthy. A very small proportion are quite sick. So the folks who really need this kind of team-based care are folks who are in their 80s and 90s who really struggle to get out of the house. And that's about 5%. So the good news is that you don't have to provide this kind of care to all elders, but you need to provide it to that 5% who are the most sick and the most high cost for society.
Well, I was told that whether the figure is 7 or 8 or 9, but a percentage like that actually takes up 80 to 85% of all of the medical costs and procedures in the United States, and that if we can figure ways of doing it better, it will help everybody. But I guess my next question is, well, you're also using nurse practitioners in this. Am I also correct on that?
That's correct.
Do you work with the nurse practitioner? Do you think it's like a team effort that can be developed?
Yes, that's a key message. The care of these patients who are very complex, very sick, nurse practitioners are a key part of the team. So doctors sometimes are trained to handle the more complex, very sick, unstable level of medical care. But we work together. Every patient in our practice here in D.C. has a nurse practitioner and a doctor, and a social worker if needed. So it's a team approach that works best. And the evidence is that the team approach has a greater benefit for the patient and family, but it also has a greater impact on reducing the cost of care.
Your website again for our audience, should they want to know more?
It's www.aahcm.org.
We're talking with Dr. Eric DeJonge. He's a practitioner in the Washington area. You've been doing it for 20 years. Do you get tired of doing it, or what is it about that attracts you to this and keeps you going every day?
Sure. So I actually don't get tired of it. I really enjoy it. I find it gives me energy on a daily basis to do the clinical work, the patient care work. Just today I was out on house calls in D.C. and I saw a gentleman who's turning 80 years old in a week. And he said he never thought he was going to make it because he has such terrible emphysema and lung disease. And he's just very pleased that with the home-based medical care, he can get the oxygen he needs, the breathing treatments he needs, the medical attention, the nursing attention, and he's actually now survived longer than he expected because he was getting good home-based medical care.
I remember Mickey Mantle's great line, gee, if I had known I was going to live this long, I would have taken better care of my body.
Yeah.
Well, I'm 75, and sometimes it's hard for me to imagine that I've made it this far, given some of the things that I've done, stupid things I've done in life. What are you doing to encourage other doctors to get into the field?
Yeah, that's a great question. So we need doctors, we need NPs, we need students of all these disciplines to get into the field. And the kind of paper that our our academy recently produced was work done in collaboration with the John A. Hartford Foundation, which is the biggest funder of aging research and kind of development of workforce in the country. John A. Hartford Foundation, and they are doing a lot of work to do training of all the disciplines, the medical, the nurse practitioner, the social workers, and funding faculty for training that workforce. But ultimately, Don, you need to have a financial way to bring people into the field as well. You have to show them how much fun and how rewarding it is, but we need to also change the payment system. So we're working with Medicare and Medicaid, the federal government, to try to improve payment for this kind of care. And so that's the second big thing that we're doing.
Well, you're certainly in the right area to do it. We need that. But let me ask you, sometimes when you get old, you get curmudgeon-y. And sometimes from sheer loneliness, et cetera. How do you deal with the patient, an elderly patient that, for instance, won't take their medicines, or it's a problem. I remember I couldn't sometimes convince my father to take his medicine when he should. We all run into these caregiver problems. And we turn to the professionals, and one of the things I had to learn was how to cajole him into taking his medicines or remembering to take it.
Mm-hmm. Yeah, so there's two things that I would say about that. One is I like to listen first and understand why the patient is saying or doing the things they're doing. What is important to them. And if their medications are not important to them, something else is. And I first try to understand the patient and why they're doing what they're doing. And if you understand why, then sometimes you can actually negotiate a common ground or help them achieve the goals that they have in their life. The second thing about medications is that many elders are on too many medications. And in geriatrics, which is my field, a big emphasis that I have, and I do this every day on my house calls or in the hospital, is I try to reduce the number of medications that people are on. Because usually they're having too many side effects and having too many medications. And if you can make it simple, right, you take these 4 medicines once a day. If you make it simpler and a less number of pills, I find that helps to convince older folks that maybe it's worthwhile doing it.
Well, how do you deal with you start to see the onset of senility and Alzheimer? Mm-hmm. How do you deal with that? And more importantly, I guess, how do you deal with the families, who are oftentimes the deniers that it's happening or refuse it?
Right. So first for the patient, you try to make sure you make the right diagnosis. So there's lots of different causes of dementia. There's the one everyone hears about, which is Alzheimer's disease. But there are many other causes of dementia, including strokes, other more rare neurologic diseases. So the first job we have is to make sure we're making a correct diagnosis, because that may change how you treat the patient. Then you have to educate the family. You have to talk to them about what the cause the dementia, what the future is going to look like, how much care that patient needs. So there's a lot of effort on education of the caregivers about both the medical side, but also the daily kind of services that the patient may need. So that's our general approach.
I would think that visiting in the home, you're oftentimes can spot things that either there's no one there to know, or family and friends don't recognize. I remember the case of my mother-in-law. It was not recognizing. She left the burners on the stove, which I was subsequently told is one of the first signs of dementia. Then I discovered that I'd leave the burners on all the time, according to my wife, so I get worried.
Right. Well, visiting the home does have a huge advantage for helping care for dementia patients. You can see the patient's family, their environment, whether it's safe or not safe, what kind of things that memory problems may cause. So seeing the home environment in a dementia patient is more valuable probably than anything else I can think of to help guide their care.
Well, I think it's absolutely wonderful what you're doing. We're talking with Dr. Eric DeJonge. Your organization again for
the American Academy of Home Care Medicine, AAHCM.org.
Well, by the way, a link to that site will be on recalculating.biz tonight. I have to tell you, you're doing a wonderful thing. I'm overwhelmed. If it doesn't come across, I'm overwhelmed because I went through it with both my parents, and I know the heartache that is involved. Because what is it? The child becomes the father of the man.
Yes.
Of the father, and you have to make decisions. Then the most difficult one is what do you do when you recognize that home care is no longer an option, and you must put them in some sort of assisted living? What do you do in that case, and how do you recognize it, and how do you help the patient reach that decision and accept it?
Well, that's a great question, and it sometimes is a very hard question. But the first thing we do is we have our team see the patient at home, talk to the key family members, and identify, is there a safety problem here? Is the patient able to or unable to take care of themselves, their basic hygiene? There's something called activities of daily living, ADLs, activities of daily living. And can that patient get to the bathroom? Can they dress themselves, walk, feed themselves? Can they do the basics? If they can, then the next step is, can they do shopping and finances and kind of the other things to help maintain themselves safely in the community? If they cannot do that, then you have to decide, is there someone else in the home who can, so they do those things, so they can stay at home? And if there is not a family member or a devoted caregiver at the home, that's when you start to think about, we may need to have them move to a higher level of care. So you assess the patient, their ability to do self-care and manage finances and shopping. If there isn't a helper, a family member or caregiver who is available and feels is healthy and is able to do it, that's the point at which you start to think maybe they should move to a higher level.
Well, the other question, we've had a major shift. Before, our older people lived with families. That is no longer the case in America today. Are most of your patients living alone, or are they living with families, or is there patterns that you're seeing?
Yeah, sure. It's a great question. So we do have a lot of fragmentation in America. It's a very individualistic society. People move all over the country, and they may move away from home. So then who takes care of mom and dad? And what we have found, at least here in D.C., that probably 2/3 of our patients have some family member who is living with them. About 1/3 of them are alone, and sometimes struggle a little bit more. It's interesting. There are some cultural differences. The Asian community and the African American community have a higher rate of living with their elders than the Caucasian community does when they've actually studied this. So there are cultural differences depending on heritage and tradition of who tends to stay at home. Now that's a generalization, so there's always a lot of individual differences, but you have to understand the culture of the patient and the family that you're caring for as well.
Well, in our recent survey of small business owners, what surprised us, female business owners and leaders. Our audience is 59% presidents and/or owners of businesses. One of the things that surfaced in the study was the fact that women business owners said that they have, I think it was something like 22% of the respondents said that they had a partial or full responsibility for parent.
Wow.
And which we thought was a high number. It wasn't even a question. It was, what are other concerns? And that kept popping up, that you can rest assured on our next survey is going to be highlighted. But I guess my question is, there's always been the point that the women are always expected to take care of the parents. Do you see that changing, or is it still that there seems to be more reliance on women than men to take care of parents?
Well, the bottom line is that the vast majority of caregivers for parents are women, daughters, spouses, women who often live longer than men, or stay healthier longer than men. So the vast majority is still women. I think it's in the ballpark of 80% of family caregivers are women, if not higher. That can change, right? I think we should, with public awareness and education and kind of understanding that it's just as appropriate for a man or a son or a husband to care for their loved one as it is for a woman. But women tend to take the lead.
Yeah, that is true. Unfortunately, Dr. Eric DeJonge, we reached the end of our time with you. Your website again for our listeners, and
sure,
because I'm sure they're going to ask a question: where can they find a doctor like you near them?
Yeah, and there is a provider locator on our website, but the website is aahcm.org.
Thank you, Dr. Eric DeJonge, for being with us today. A link to that website will be on recalculating.biz tonight, where you can hear this and every other past and future program. Thank you so much for your work and what you're doing.
All right. Thank you, Don. Have a good day.
You too.
Want to know more about health savings accounts for your company or yourself? Go to 2hsa.com and get a free employer's primer. Health savings accounts are a cost-effective way of offering health care benefits to your employees and yourself. HSAs build retirement funds for your employees, improve morale, and reduce your health care benefit cost. For a free employer guide to HSAs, go to 2hsa.com. That's 2hsa.com.
Dan, speaking of books, tell us how your newest book's going.
It's doing extremely well. It's Why Can't Grammy Remember Me? It's in its right now we're in the final week of a 4-week marketing campaign, and we're approaching 65,000 page views and almost 5,000 books that have been sold in less than 4 weeks. Just astronomical numbers, and I think it's a subject matter. Dementia is something that we have to deal with as a nation and a world, because it's not only just in the United States, it's all over Europe and Asia, and the world gets older, more and more cases of dementia. So it's a wonderful book to help families understand what's going on with dementia and how to talk to our children, which are the people who are lost more than anybody else. Dan Perkins here from recalculating.biz with your featured book. I want to tell you about a recent interview I had with Bob Bethel, a turnaround specialist with lots of success in small business. Bob's new book is Strengthen Your Business, Fail-Proof Strategies for Small Business. He tells us of his life successes and failures that have made him and his clients so successful. Over the years, Bob has brought 77 companies back from the brink and changed them into thriving, profitable businesses. His energy is amazing, and at 74, he proves that you can still have a great deal to give others if you just try. His suggestions are easy to understand and very helpful. One insight struck me was that most companies do not have a plan. The old Chinese proverb says, "If you don't know where you're going, then any road will take you there," is true today. Bob Bethel's book, Strengthen Your Business, can be found at Amazon.com or can be ordered at your local bookstore. This has been Dan Perkins with your Recalculating.biz featured book.
I'm Don Mazzella. My co-host, Dan Perkins, is on assignment, but we have a really fascinating guest today, and she has an absolutely fascinating company. Tasha Mayberry, welcome to the program.
Thank you so much, Don.
Tasha, first off, tell us a little bit about yourself. You have a fascinating background, and we'd like to first know a little bit about you.
It did start in the paralegal field, and I was going to be on my way to law school. But then in 2008, when the market crashed, I was laid off, and I was out of work for a year. So I started to think, geez, I need to start thinking about what else I'm good at. So I actually loved writing and being creative. So I started temping and doing social media. And within 4 months, I landed a corporate job in the marketing and PR world, and soon after that became the VP of marketing and PR. So I climbed rather quickly. It was very exciting. And when I met my husband in New York City, he had schooling for many, many years as a web developer, and I had done all the PR and marketing for years. So I said, hey, let's team up. So that's exactly what we did, and we started our own business, Social Media 22. So web design, SEO, creative sales marketing, things of that nature. It's been about 7 years in business, working together. So from there, we launched Best in Baby Biz magazine, which is for parents. And I actually have started 7 businesses, so I won't go through them all. But the newest venture, BuzzBox, is very exciting.
Oh, okay. Now, tell us about BuzzBox, and finish up by telling us the website.
Oh, great. So, yes, BuzzBox is the coolest, quickest, and most affordable way to generate buzz for awesome products that are out on the market. And we are owned by 2 publicists, myself and my partner. We've been publicists for 10-plus years, so very seasoned at what we do. And we identified some flaws with traditional PR, so we came up with BuzzBox. And in fact, just to give some more idea of what it is, it's not an ongoing subscription box. Instead, think of it more of like a PR campaign in a box. So what we do is we come up with these themed boxes, and we curate 10 products to fit that theme, and then we ship them to top national press. And here's the real kicker. We actually get the press interested first to receive a specific themed box. So that's why it just removes months and weeks of PR, the usual PR legwork, as well as a lot of money that brands have to spend to usually get the attention of these big press. So it's been very exciting, and we don't stop there. The press is like the first level of buzz that we generate for products. But then we have an influencer network with large audiences, and we utilize shoppers and consumers to generate buzz. Through our giveaways, we have a Buzz Points reward system, and we even have a cool Buzz shop on our website that's going live soon. So anything we have in our boxes that we send to the press, if people love it and want to buy it, they can actually buy it from the shop. And it's nice, too, because that's totally optional for brands who work with us. And because we have our own shop, we can actually have our own affiliate program. So now our influencers are motivated even more to start sharing about these products. So think of BuzzBox as a way to get massive buzz out there about your product on 3 levels: press, influencers, and shoppers. And to recap that, the website is buzzboxpr.com.
This is radio. Will you spell it out for our audience?
Oh, sure. B like boy, U-Z-Z, B like boy, O-X, P like Paul, R.com. buzzboxpr.com.
Okay. So our audience is small business. 59% of our audience are presidents and/or owners. So if what you're saying, if I understand it, is if they have a product that they want to spread the word about, you have a fairly unique way of doing it. Did I hear correctly?
Yes, exactly. It's a really unique, because we as publicists work extremely hard. So we're not saying that, this is should replace traditional PR, because we know that at work, but we just know that traditional PR takes a lot of time and a lot of money. So it's a new solution. It's a new option. As publicists, we identified a few flaws in traditional PR that BuzzBox solves. First is the time. So a traditional PR campaign, it's not uncommon that you have to get a 6 to 12-month contract, because it does take a lot of work and a lot of time to understand the brand, to come up with a creative pitch calendar, to create the content, and then the pitching and follow-up alone is it's a mountain of work. So with BuzzBox, we actually garner the interest of the press ahead of time, and they get 10 products all at once. Another flaw, to bring this full circle, is we call it the back burner result. So essentially, if you send a sample to the press using a traditional PR campaign and they love the product, that's a good thing. But usually what happens is they put it on the back burner until a topic or a story or a theme comes along that they can fit that product in. Because otherwise, if they just do editorial just on that one product, it tends to be too promotional. So they'll come up with a theme, they'll add a bunch of other products in the story to make it more like of a roundup. So they not only have to wait for a story idea to come around, but they have to find the other products to sort of fit that theme. So with BuzzBox, we do all the work for them. Not all the work, because of course the press works very hard, but a lot of the work is done for them. They have the theme. They have 10 very unique products that fit that theme right in their hands. So they can actually run with a story, whether it be TV, radio, print, and they have everything right there. And if I may add, another flaw is the money. So it's just very expensive, to pay for wait-and-see results. That's what we say, because there's no guarantees in PR. So if you're waiting 6 months to see results, at the end of 6 months, if a company's not happy, they've already paid for all those months. So BuzzBox is just a very quick way to see results within weeks, instead of having to put up all that money. So it is ideal for business owners, especially because the bottom line is very important.
So let me see if I understand it. And what I'm thinking, let's say someone comes to you that has a baby product, and let's say it's a rattle, for lack of anything else, is a brand new rattle. You kind of package it with 2 or 3 other related items, and then create a box and send it to people, to PR people who are involved in the whose audiences are mothers and grandmothers or people like that. Am I hearing you correctly?
Yes, pretty much. So, for example, we have a baby and kids box that we're doing right now for the best baby and kids holiday gifts.
What kind of a box is it? I'm sorry.
Oh, so the theme. So it's called BuzzBox, but we come up with these themes. So we have a baby and kids box right now. So it's like a best gifts for the holidays for baby and kids. So in this box, we curate top 10 products that fit that theme. So it's only going to be baby and kids items in that box. So yeah, you're absolutely right. So for example, if we put that rattle in there, we're not going to get any other rattle or competing brand to go in that box. The other 9 products will be, something different related to baby and kids, for this particular theme. And we package it beautifully in a BuzzBox branded. So when the press get it, they know, oh yeah, that's the BuzzBox that I requested. So it's just beautifully packaged, and they get to keep the samples, of course. But the real important thing is we have the press that already requests the box ahead of time. So we have like the Today Show, Red Tricycle, Pop Sugar, Forbes, Washington Post, Esquire, Parents Magazine, Pregnancy and Newborn. The list is extensive, and they all have interest ahead of time, which is really exciting.
Mm-hmm. And how do you generate the list? So
my business partner and I, TK, we have both been longtime publicists. So we have press list already that we've been working with, for many years, and especially the list that I use. So we have those lists, and we just reach out to the contacts and invite them to be part of BuzzBox. So that's how we do it.
We're talking with Tasha Mayberry. She is one of the co-owners of BuzzBox, and her website is buzzboxpr.com.
Thank you.
And so, I understand it, and like say a small business has come up with a product, they would come to you and say, we think it would benefit from, if I hear you correctly, you send it to the press, to influencers, and also others that have the ability to get the word out. Am I hearing that correctly?
Yes. So the actual BuzzBox campaign, so per theme, there's 15 boxes. So say a brand wants to sign up, they would provide 15 samples of their product to go in those 15 boxes. And then we send those 15 boxes to the very top high audience press that have already requested that specific themed box. And then on a secondary level, we do use the influencers and the shoppers to generate buzz, but they do that in a little bit different way. Like, for example, for each BuzzBox campaign, there's 15 that go to top press, but the client, the brand, the company, sends one additional sample. And what we do is we make a giveaway box, because these boxes cannot be purchased like all together. They're only exclusive for the press to receive. So now we have this giveaway box that one of our fans can win. So it makes it really exclusive and exciting. And to win this box, they get into our viral giveaway software, and it's really easy. They just enter name and email, and they can earn points. We call it Buzz Points. So the more they share on social media using their referral link or refer friends, they generate these Buzz Points. So they get a chance to win one of our themed boxes, and we also have cash prizes, which cash is always a motivator. So now, and the influencers do the same thing. They actually are able to share the giveaway, and in exchange, we actually give them some additional perks. So I guess you can say the press receives the physical box, and the influencers and the shoppers are creating buzz online.
Very interesting. It's an interesting approach to PR. And normally in a campaign, you start out, you send out a press release, etc., and you hope to get somebody back that says that they want to see the product. Your idea is you take the top 15 press people in that particular area, and they have to opt into the service as well. Am I correct?
Yes, exactly. It's completely free for the press to sign up, so they don't pay a charge or a fee or anything. But yes, they sign up. They have to actually sign up and say, yes, I want, for example, the baby and kids box. So we know when we pick the top 15 to receive that box, we know it's getting in the hands of someone that's, already interested. Because otherwise you're just shipping blindly to the press, and they might not be interested. And the whole goal is to get as much big press features for these companies. So yes, that's exactly how it works.
Well, it's interesting. There's a group out in California that does shows for the press here in New York and in Los Angeles, where the companies actually go there and meet the press. Press is invited. Your idea is we're not going to depend on the press to come to us. We're going to go to the press. Am I hearing that correctly?
Yes, that is correct. And I know exactly the event that you're talking about because we actually met there a couple times. So, yes, that's a good way to explain it. The press, they get a ton of pitches every day. Just imagine how many people, thousands or hundreds of people are, pitching the press. So, they have a hard job to sift through everything. So as publicists, we always want to make it easier for the press. So they really enjoy working with us because we do make it more, instead of like if they have a segment that they have to do and they're choosing 5 to 10 products, usually they have to go back and forth with 10 different companies or publicists. It's a lot of work. So now with BuzzBox, it's great because we're the sole contact. They need high-res images or they need dish TV, whatever they need, those 10 brands in the box, they just filter through us. So it's great for all parties. The companies are getting noticed and picked up by big press. It's great for us as publicists because it's less follow-up and busy work. But not more importantly, but also, in addition, the press, it's easier for them to receive 10 products at once that are all themed.
You know us press people are lazy by nature. And how do you charge?
So that's another great part about BuzzBox. Because usually the big coveted press spots, all the big press are given to brands that have a really big budget for PR. I mean, sometimes, that's just how it happens because they have more feet on the ground, more pitching. So we really wanted to level the playing field between the smallest startup company to even the big companies and just give everybody the same voice. So that's why we kept the pricing very affordable. So there's no long-term contracts. It's a pay-as-you-go model. If you want to do 2 campaigns now, if you want to do 1 every quarter, it's just the company chooses, which is really great. So it's $500 per campaign. So again, it's very, very affordable. You get all of the perks included, on the 3 tiers: press, influencers, and the shoppers. 15 samples, or 16 rather, 15 for the press and 1 for the giveaway are required. So that's a little bit of a cost, factor as well. And then if you buy more than 1 box, you can buy 4 campaigns and save $300, things of that nature.
So let me see if I heard that correctly. So to do that, to do one box is $300. Is it $300 per box or $300 total? I'm sorry, I didn't quite understand that.
Oh, sure. Yes, it's actually $100 per BuzzBox campaign. So remember, in each campaign, there are 15 boxes that go to the top press, and then there's 1 giveaway box that we use. So per campaign, 15 boxes plus the giveaway is $500. But if you buy more than 1 campaign, like say you want to do 4 campaigns, that's 4 times 15, that's 60 boxes. That would be, 60 boxes. So that would be $1,800. You just save, actually $200 is what you save. So pay as you go, 1 campaign at a time, still very affordable, or you can buy more and save a little bit.
Well, I'm sorry, Tasha. It seems awfully cheap to me. You can get to the 15 top people with my product for $300. Did I hear that correctly?
Well, for $500. Yeah, it's very affordable, and we like it like that. we want to stand out. We want to be different. So
you are. I'm sorry I keep coming back to this because knowing what PR people charge, etc. It's not $500 per box. It's $500 for the 15 boxes. Am I correct?
Exactly.
Wow.
Yep, per theme, per campaign. Yes, I know. We get that reaction a lot, but a lot of the startups, that's a lot of money for them. So again, we want to level the playing field. Startups, shoestring budget, medium, big, whatever type of business.
But they're getting for, and again, I keep going back to that number because I find that absolutely knowing, having been on the other side of the fence and having worked with the PR firms for an awful long time, it seems to me that you are taking one of the most difficult things in the world, which is to get to top press people for $500. It seems like a fantastically low price. If I had a product, I'd buy tomorrow.
Oh, thank you so much. I'm just, because we still do traditional PR, for people that need it, whatnot, but we know just how much work it takes just to get like one big outlet to pay attention or to feature you.
Yes.
Now, from these buzz boxes, to get people 7, 8, 9, 20 features, it's just incredible. And what happens is they buy more buzz boxes. So we do really great. We give a great price, great results. We're just going to get more companies, and that's what we want. We just want to help more companies. So that's why we're okay with the price being that low. And from that, we pay for the shipping and the boxes, and of course from our time. But there's 10 products in each box, so you have to remember that. It adds up.
Well, let me go a little further, because what you're talking about is, what are some of the 15 press outlets that you go after? Does it vary by the products, or is it just the same 15?
Oh no, it's different for each and every campaign. So what we do is we send out an email invite every so often, every couple of weeks, every month, to our press list, and they check off all the themes, because we know ahead of time what themes we have going on now and what will be upcoming the next 3 months. So they go ahead and check off all the themes that they're interested in. So now we have a database, and we can export and see, okay, all of these press signed up. Here are the ones that want the gifts for foodies box or the gifts for him box. So then we sort of pick and choose the 15. So it's different. I mean, there could be some overlap if it's a different theme, but generally it's 15 new press contacts per theme. And then maybe in a year or down the road, it could be some of the new ones are ready to feature again.
But are they primarily consumer products, or are there business-to-business products as well?
Oh, that's a good idea. Well, I guess it could be any type of product, as long as we're getting it into the right, the press, if it's like tech or, but generally, I mean, it has been consumer products.
No, the reason I ask is I attend many of these press previews to find people for this show, and these people are paying for a booth to give away the merchandise, etc. And they're spending thousands of dollars, and you're doing it for $500. I keep coming back to that price, because it is a relative bargain.
Yes, it's a huge bargain, especially, a lot of companies are used to traditional PR and what it costs. I mean, our lowest PR package starts at like traditional PR, $1,500 a month. I mean, bigger companies can easily spend $5,000 a month, every single month, and it comes down to ROI. We hear a lot of feedback over the years that, yes, we get great results, but the brands are always left wondering, is the ROI there? All this money being dumped into traditional PR, and, we're not saying that it's a bad thing. Publicists work very hard, and they earn their keep, and, traditional PR does work, but it's just a lot. It's a big investment, and you have to wait long for results. So, yeah, we like to keep it low, and one campaign, a quick turnaround, and then brands are happy, so then they sign up, for a new campaign.
Tasha, give us an example of some of the products that are in a buzz box, and who gets them.
Okay, yes. So we just sent out some newly themed boxes, and just to give you an idea, let's start with our beauty and lifestyle box. So, for example, we had Quan bracelets in there, an awesome company that's donating back to charity. We had Zizzy Bee bags, which are amazing. They actually are reusable, washable, and see-through storage bags that replace up to 1,000 or more single-use plastic bags, like large Ziplocs, for example. So they have a big initiative with winning the war on plastic and all that great stuff. There was another awesome product in our beauty and lifestyle box that just went out called Soakies. And just imagine it's like a pedicure foot soak solution on the go. So these cool boots, you just put them on and you literally are soaking your feet. It could be for beauty reasons, but a lot of women like to use it as well. during pregnancy to, help circulation and all that good stuff. Piggy Paint was another amazing product that was in the Beauty and Lifestyle box, and this has a great story. See, that's what's so awesome about, all these products, behind them. They have such amazing stories. So we do tell the actual story of the brand as well once we get it into the press's hands. So for Piggy Paint, she was painting her her little girl's nails just with regular polish, and she was using a styrofoam plate to catch the nail polish. And she noticed that the nail polish ate a hole right through the styrofoam plate. So she was thinking to herself, geez, if it does that to the styrofoam plate, what is it doing to my kids if they have their fingers in their mouth? So anyway, she invented Piggy Paint, which is, their slogan is natural as mud. So it's just a non-toxic nail polish, and they even have a line for adults as well. So these are just some examples of what, went into our boxes. So we curate really unique items, and I can even share who these boxes went to, like specific press.
Well, just give us a couple of outlets that have gotten these buzz boxes.
Okay, so for the lifestyle and beauty, and we partner, we make sure the boxes get into the right hands, because remember, the press is coming to us saying that they want this specific box. So the Beauty and Lifestyle box just went out to Fox News, Real Simple Magazine, Red Tricycle, Shape Magazine, LA Times, The Knot, Pop Sugar, Reader's Digest. So these are some really big, well-known national publications. So it's really exciting.
Mm-hmm. Well, your product is so exciting, Tasha. It's really been a pleasure. You've blown my mind. Again, for our audience, your website?
The website is www.buzzboxpr.com. B like boy, U, Z, Z, B like boy, O, X, P like Paul, R.com.
Well, a link to that website will be on recalculating.biz tonight, where you can hear this and every other past and future recalculating program. And you can also, by the way, tell us guests you'd like to hear. Again, Tasha, thank you so much for being with us. It's been a real interesting time.
Oh, thank you so much. I appreciate the opportunity. I just absolutely love your shows on recalculating. So great work.
Well, thank you. Marcus Lemonis, J.D. Powers, and John Scully, and 100 other presidents and experts contributed to Recalculating the book. Why did all these people agree to contribute to the book? I'm Don Mazzella, and I'm the editorial director of Small Business Digest. And for 20 years, we have been offering small business leaders information and data to increase profits. Recalculating the book was named the best small business book by the Independent Press Association. Whether you need help with marketing, staffing, finance, operations, technology, or many other subjects, they're all here in Recalculating the book. They're now available at Amazon at a reduced cost. We've also created the radio program Recalculating on recalculating.biz.
Dan Perkins here with your Recalculating Small Business Tip of the Day. Did you know that a candle can be an energy saver for home and office? An old-fashioned candle can be a new-fashioned energy saver, and at the same time provide a warm glow to any home office. Adding a candle seems like a silly thing to do, but it can help check for drafts. You can use the candle to test if new windows are needed. Here's how. First, take a roll of blue painter's tape and tear off pieces and put them on your left arm. Pass the candle around the opening and mark the spots around each window and door where the candle flame flickers. When you have finished your test, step back and see if you have tape around all of the window or only one side. The more tape you have on the window, the more money you will save by replacing those windows and doors. Check out recalculating.biz for more useful small business suggestions. This has been Dan Perkins with your Small Business Tip of the Day.
Thank you for joining us on Recalculating. We hope the information you received on today's episode was helpful to you in starting and growing your business. Please go to our website, recalculating.biz, to contact us, to listen to past shows, and see special offers. Until next time, remember, if you grow, we grow. Join us next week for more helpful ideas to make your business a great success. Recalculating, a program designed to help you be successful.